nobody wants to hear that whatever symptoms they're experiencing is all in their head and it'll be fine if they just get a new partner. That's not what you want to hear. When you go to a doctor, you're hoping to find some solutions. You're trying to figure out what's going on with your body and what's happening, and that you want to know that you're not broken. There's not something wrong with you.
Absolutely, yes. And so you're speaking a little bit to this notion of the interface between mental health and OB/GYN. And this was frequent enough in a few of the hospitals that I worked in, several hospitals, when I finally did get released as a resident and then began to be an attending in Cincinnati, that the consult conduit between OB/GYN and psychiatry was pretty strong for some doctors. There were some obstetricians and gynecologists who really felt that they could receive help, appropriate help from mental health providers. And I would be frequently in the consult liaison rotation that I was in at these hospitals. I could be frequently consulted by that particular subspecialty. You had mentioned earlier that this in the fourth trimester, there's sometimes things that can happen in the postpartum blues or the postpartum psychosis. What is it that you find that you can do to really, this is a loaded question because I'm no longer the same doctor I was back then, by the way. But what is it that you can find that either psychiatry can do or mental health can do, or you can do to help your clients in that fourth trimester when they're going through those psychological discomforts or psychological pains or traumas or miseries, or yeah, that might be go along with being in the fourth trimester of a delivery.
I think you mentioned it before, and I think one of the most important things we can do is communicate, right? Communicate with our patients more than just at the 6-week visit. I think now what I've noticed is that there is a trend to see patients a little bit more frequently, even postpartum. I know that one of the clinics that I work at, they see patients 1 week after, and then 2 weeks after, and then 6 weeks after. But I think that having that constant communication with the patient is really important because so many women suffer through anxiety and depression and blues after they give birth. And a lot of times they don't have that family support to help them navigate those emotions and those feelings. And so then it behooves the provider to follow up on that patient. The problem that we have with our system is that we are asked to see patients every 15 minutes. So it's hard to spend that time with that patient that may be suffering from a little bit of anxiety or depression or adjustment disorder after they have the baby, and to really figure out what's going on with them and how they're feeling. One thing that does help us as OBGYNs is the Edinburgh depression scale that we do postpartum, and also the PHQ-9, both of which help to figure out whether or not a patient is experiencing depression. Something that ACOG has recently, and I think it's been a few years now, but they've advocated for OBGYNs actually doing that depression scale in every trimester and definitely postpartum to help figure out whether or not a patient is experiencing anxiety or depression and whether or not they need additional support and help via a psychologist or a psychiatrist or somebody, or even meds during the pregnancy. And so I think that is really important to help patients navigate their feelings and their emotions during the pregnancy and even postpartum.
Excuse me.